today we got a really exciting guest, which is Dr. Greg Williams, and he is a hair loss plastic surgeon, hair transplant surgeon. And I think I've got to the stage of having him on first, because I was going to have on some other people, because so many of you have talked to me and we've spoken about on this channel about hair loss, thinning hair, and your worry of what you can do about it. So I just thought, let me get on the best person. And the way I always find the best person in this field is I call up Alice Hart Davis. And Alice Hart Davis, as many of you know, because I've had her on this channel, is the author of The Treatments Guide. And I don't know any woman who I feel has better researched surgeons and experts around England and also slightly further afield in different areas. So she said to me, I said, do you happen to know? And she went, Dr. Greg Williams, nobody else to talk to. So I was very excited by that. So I then emailed Dr. Williams and I said, look, would you be prepared to come on and chat to us? Now, I'm going to have, just so you know, next week, this is an option which is the kind of most extreme option. We're going to go through all the different things that it entails, from tattooing your hairline to full-on hair transplant surgery. And then next week, I'm going to have Shabir from Victoria Health, who you've heard before, talk about his view on supplements. And I'm going to have Josh Wood from Josh Wood Color Hair to talk about hairstyles and things you can do to disguise hair loss if you don't want to go the full anti of, you know, having what we might be discussing today. So I just want you to know, if you don't feel that you can go this full extent of what we're going to discuss today, next week are little things that you can do to help you on that journey. And we will be taking questions today on hair loss. So it's quite a targeted show, just to give you an awareness. And I know that you would want to ask me 1,001 other questions, but I can maybe think about, we can, you know, we have skincare Q&A every Wednesday, ladies, so we can leave them all till then. But if you are at all perimenopausal, menopausal, you might have more reason to feel hair loss. And then also it could be that you have gone through cancer, or you are going through a treatment, or you have some illnesses which can cause hair loss. So without further ado, please let us welcome Dr. Greg Williams. Good morning. How are you?
Good morning. I'm very well. Thank you so much for having me. I'm really excited to talk to your audience on this subject.
I'm very, very excited talking. And just to explain Greg's incredibly fabulous headgear, I know you've just come or just about to go to afterwards a hair transplant operation. So it's very nice that you can come out of surgery and talk to us. Makes it feel all the more closer for us. Now, it's such a big subject. And I just want to start, Greg, with what are the most common causes for you of hair loss, and how often are women misdiagnosed, you know, or not really, it's not explained to them? So just that opener.
Yeah, and it's a really good question. So two parts. What's the commonest cause? Unquestionably, it's genetic hair loss, and I think for this we'll leave the men out of it, and focus on the women. And so it's genetic hair loss. But when people think about hair loss, they tend to focus on one element, or what they think the hair loss is. There's so many causes of hair loss, and so it's so important to get the right diagnosis. And you know what? It's not something that's taught much in medical school, so GPs don't know much about it. And it's sad that actually a lot of dermatologists don't know that much about it. There are only a handful of real hair specialist dermatologists. There is a group of people called trichologists. These are non-doctors who specialize in scalp and hair loss. And they may be a good starting point, but that's an unregulated field, and you get good trichologists and bad trichologists. So the first step is to get a diagnosis.
Okay. Now, already we've got a lot of people talking about different reasons they feel that they've got hair loss. So somebody said, my hair loss started after my hip replacement. Another person said, post-COVID, I felt I've had hair loss. Other people are saying, post-cancer treatment, I feel I have suffered hair loss. Obviously, you know, if you've had chemo, that might have been, you've had your hair totally gone, and then it's growing back differently. So alopecia is another big one too. Can I ask you honestly, do you feel we know medically why we lose hair?
So first thing I want to clarify is alopecia means hair loss. So all forms of hair loss are alopecia. When people say alopecia, they're quite often referring to alopecia areata, which is commonly thought to be stress-induced patches of hair loss, little round patches, but they can extend right to hair loss on the entirety of your head and, in fact, the entirety of your body. So that's alopecia areata. But in answer to the question, do we really know about? In men, yes, we've got a pretty good idea. In things like what we call scarring alopecia, so these are autoimmune conditions. The names that people might be familiar with are lichen planopilaris, frontal fibrosing alopecia, centrifugal cicatricial alopecia. These are scarring alopecias where your body attacks the hair, destroys it. We know those causes. Female hair loss.
I know that some of those are stress. When people say, you know, I went through something incredibly stressful and I experienced hair loss. Do you believe that, Greg?
Yeah, absolutely.
So, I'm not denying that women feel that at all, but I'm just saying, do you believe that's a chemical possibility?
100%. That's called telogen effluvium. It quite commonly occurs 3 to 4 months after a physical, psychological, emotional trauma, so major surgery, a major illness. That's what we think we're seeing a lot with COVID. This is telogen effluvium. The hair then starts to regrow after 4 months, but it takes a long time, maybe a year. If you've got hair your length, maybe 2 years before you're going to get that full volume back after that, essentially a kind of a shock loss. But
so you do believe that COVID, because a lot of people have discussed this on my channel who've had COVID, and I myself, Greg, feel that, you know, I had COVID relatively, I didn't go to hospital, but I felt quite sick. And, you know, I noticed I have here, and I noticed that's just, you know, that's really now got worse. And that's I'm now 57, and it's just a progression. I'm on supplementary hormone replacement therapy. But I mean, if you feel that stress has had a part, do you think it will always grow back? Do you think that sometimes it doesn't?
Yeah, I think sometimes it probably doesn't. So there is something called chronic telogen effluvium. So there's acute telogen effluvium, chronic, and these are things rarely you need a hair specialist dermatologist to diagnose. And sometimes it requires a biopsy. So a little piece of scalp skin is taken and looked under the microscope. But again, you need, the people who look at it are called a histopathologist. You need an expert hair histopathologist to differentiate the fine differences in what they're seeing. So yes, I do believe you can have long-term chronic hair loss, but usually it will recover, and you just need to be patient. But you need to, like I say, wait a year, 2 years. But I just want to go back to that question you asked about, do we understand female hair loss? And the answer is no. I mean, I had a conversation with possibly the UK's leading dermatology expert in female hair loss, Prof. Andrew Messenger, and we were talking about a couple of things, but I asked him specifically about this, and we don't. And it's really sad in this day and age. We don't know specifically around menopause. Is it a lack of male hormones, or the flux in male and female hormones? We really, unfortunately, just don't know. We do know because that women.
I mean, when you say, Greg, that you know about male hair loss, and male hair loss can traditionally be triggered by an overstimulation of testosterone.
No, again, it's a whole different conversation, but male hair loss is called by dihydrotestosterone. It's a metabolite of testosterone. We're pretty confident in this. I don't, you know, when a man asks for a hair transplant, I generally don't do any tests at all. With a woman, I don't even see them until they've had a battery of blood tests. We know all about their medical history. Quite often, I'll get them to see a dermatologist first. It's so complex. Nutrition in women, health in women, hormones, stress, so many things affect female hair loss.
So what you're saying is that men, you'll just know it's not going to come back and you're going to do the transplant. Women, you'll think, should they try other things first to check that those wouldn't recover their hair loss? Is that what you're saying?
Yeah, so certainly a lot of women have iron deficiency. We need to get their iron levels way up, actually above what's considered normal. Zinc and vitamin D can affect hair loss in women.
Okay.
But rarely hormones. So, you know, with polycystic ovarian syndrome, that's one of the commonest causes of hair loss in young women.
Yeah.
And we know in pregnancy, your hair improves during pregnancy and then often significantly deteriorates after pregnancy or after breastfeeding stops. And we know that their hair starts deteriorating around the age of 25, 30, but you don't notice it probably for about 10 years. So in your mid-40s, you start to notice that your ponytail's not as it used to be. Your hair doesn't maybe grow as long as it did. It's not as thick. And then around menopause, we get the second hit, and that's when a lot of women really notice it.
Yep. I think that for all the women on now, that we, we love solutions. All right. So I think I want to move on to, I think we agree. And, when you actually, one thing I want to just mention, Greg, is when you say iron, zinc, and vitamin D, I know we're going to discuss with Shabir next week, his view on supplements. And I know you feel, do they help or not? I feel with me when I take biotin, and I take very strong amounts of biotin, some women get spots from it and it prevents them taking it. I feel it can help me. But these other deficiencies, which are not supplements that help with hair growth, but deficiencies that can lead to hair loss. Do you think it's very important to do the supplements for that?
So I don't think super supplementation is of any benefit. So if you have a deficiency, yes, you definitely want it to be supplemented, and you don't know if you have a deficiency unless it's checked. And as I say, with iron, you want to have quite high levels of what we call ferritin. I think it's probably best if we stay away from the supplement.
Okay, we'll stay away from it. That's fine.
I just want to say, biotin is a marketing success. There is no evidence for biotin supplementation in hair, but every
so maybe the time I happen to be taking it is the time that I'm upping my iron, zinc, and vitamin D, and I'm eating well, and I'm eating less sugar, and I'm not so stressed. It could be that it's some beautiful thing coming together. So, Greg, then let's move on to...
Hang on a second. Protein, really, really important. Protein. Yeah.
Do you feel that vegetarians who don't get to eat so much pure protein have thinner hair, can suffer from thinner hair?
I think if you're just like your skin and your nails, sure, your hair will suffer if you don't have an adequate protein and a balanced diet and all the nutrients, all the vitamins, trace elements that you need in a balanced diet. All
right, so protein important. Okay, now I just want to say this. There's a lady called Rachel upsetting people. Just ignore her. Yes. So I want to get on now, Greg, because we like this stage of the show. What are our solution options? So let's say for all those ladies there, you've been through an illness, your hair's thinned, you've felt that you've tried a few things like what you're saying, Greg, diet, etc. You feel your hair is still very thin. Yes, I'm sorry. Also, Stacey, I'm just going to say I didn't want to at all be rude to vegans or vegetarians. I was just saying because I am not a vegan or vegetarian, and I have to be careful also, knowing what's protein and what isn't, that vegans, vegetarians can eat a lot of great proteins in other foods. Yes, that was just very ignorant of me. So, Greg, let's say we're on a small budget, and I'm going to give you some scenarios, all right? Menopausal hair thinning here, all right? This kind of stuff, like mine, where I've got thick hair here, but I notice now that when the reason I always flick my hair, Greg, on films, and people always say, Trinny, you flick your hair so bloody much. And it's mainly because I'm slightly self-conscious to cover that up. And I don't always talk about it. But this, I used to, when I look at my hairline from in my 30s, was very strong. And now it's not. So if other women are suffering this kind of hair loss, what are the things we can do?
So I think you're absolutely right. Hair color, hairstyle, really important. Hair products as well.
Yeah.
You want to find a shampoo and
conditioner. I'm going to do that all next week. Yeah. I want you to give me the meaty stuff.
So in terms of products, camouflage products. So colored hairsprays.
No, I'm going to talk. Sorry, I'm so sorry. I'll talk about that with the hairdressers.
Yeah.
I want your technical knowledge. It's the stage after that. So if we don't want that temporary solution of just putting something in our hair, should we start with tattooing?
Yeah, so this is scalp micropigmentation. So it's different from high school tattooing. It's medical grade if it's done well, and I can tell you that it's done badly an awful lot. In the right hair color, it looks good. So in dark hair tones, it looks good. In lighter hair tones, not so much, and it can be done really, really badly. So you have to be really careful. And as you know,
is it like a micro needle? Is it like the hair microblading?
No.
I mean, is it like the eyebrow? Is it the same technique?
It's quite different. No, it's very different.
Okay, what is the technique? So they're not cutting the scalp and putting dye in the scalp.
No. This is and a good practitioner will have digital devices where you're implanting the dye, and you got to be specific with which kind of dye you're using at specific levels, and usually it's done in the form of dots.
So then, if I were to lift my hairline up, what would I see, Greg?
Yeah. So for you, it might not be the best thing given your kind of lighter hair color, especially at the front where it gets a little more blonde. So it's really suitable for dark hair. I'm not an expert in this area.
That is an option. And what's it called, just so we know?
Scalp micropigmentation, or SMP.
SMP. Okay, we're going to write these down at the end. Greg, you've done a nice list for us, and Amanda, who's running the chat, will put all this information on at the end. Okay.
If I can just shout out the Finishing Touches group, they are the most established group in the UK, and really world leaders, not only in education but in results. So Trinny, I'm a hair transplant surgeon. I'm a plastic surgeon. I used to run the burns unit in London. I left that to just do hair transplant surgery full time. For you, it's a hair transplant, no question. Yeah. I don't know if your audience. Last night I just stuck a couple before and afters in my Instagram stories. So it's at Dr. Greg Williams UK.
Yeah, I'm gonna get that up now.
Yeah, I got some. Put some before and afters of pretty much what you have and what can be achieved with a hair transplant, and it is the bee's knees. It then will allow you to pull your hair back, because nothing you're going to do is going to rejuvenate those fine, what we call miniaturized hairs, which don't really grow as long. They're not, the diameter isn't as thick, the density isn't. Nothing's going to make those back into thick hair.
Yeah, because you put here that woman there.
Yeah.
You put that woman there. And is this a woman you did?
Yeah.
Okay. And then I'm going to go to the next picture. This is thinning temples. That's what many women also might be feeling they're suffering with, that thinning temple. And then where's your nice before and after?
So the video just transitions. So if you leave it on the video, it moves to the post result.
Okay. Yeah, transitioning there. So sorry, there, that. And it transitions.
And then if you look at the other one.
That is amazing. I'm going to look at that again. So let's look at that woman again, that's me. Sorry.
Yeah.
Let me get it right. Yeah. So when I think of hair transplants, I think of bad ones I've seen on men. I'm just going to put it out there. That's my view of them. And so it might be I've come across women and I have no idea they've had a hair transplant. But how much has it moved on to look real? Not to look like you've got sort of studded. Tell me how it works. Tell me everything. We want to know every detail about it. Is it painful? How does it work? How long? Everything.
Yeah. Well, you're going to have to shut me up because I'm just going to talk and talk. So whenever you want to interrupt me. So a good modern hair transplant should look completely natural. Your hairdresser should struggle to know what's been transplanted and what isn't. The only caveat to that is women who have really, really coarse hair, because what I can't recreate is that very fine, miniaturized hair that a lot of women have at the fringe. I can't do that. What I can do, because the hair grows naturally on the head in little groupings called a follicular unit that have 1, 2, 3, 4 hairs. And when we transplant them, we move that individual grouping into a little hole. We call it a graft. And then that grows as it would have grown where we took it from. And generally, we take it from the sides and back of the head.
Does that then, can I ask you, taking it from the sides and back, that means that hair at the back will never grow again. But is that because that's where people have the most density in hair, Greg?
Yes.
Okay.
Women with diffuse hair loss, they'll usually have a little rectangle at the back that's quite thick. In men who are very bald, they've got that rim. That hair in men is not going to deteriorate. So when we move it, it will behave as it did there and it won't deteriorate. In women, it's slightly different because women with genetic pattern female loss quite often continually deteriorate all over the head. It looks thinnest there, but that's because the hair falls down. So that's where it looks thinnest.
Yeah.
But the last place it's going to deteriorate is in the center of the back of the head.
Okay.
So we move those hairs, and I put the single ones right at the front, and it's all, the angle, the direction, the geometry, the density. That's all very carefully done, and that's the artistry that's involved with an experienced hair transplant surgeon. Now, the sad thing is that there's no training in hair transplant surgery in the UK. You don't learn it in medical school. Dermatologists don't learn it. Plastic surgeons don't learn it, and there's no qualification required. So you'll have a lot of people doing it really badly, and that's what you might see.
Now, Greg, I just want to say this is not an ad for you. I just happen to always look to find the best person to talk about this. So just to talk through that, and we will talk about PRP later. We will talk about things that are not so expensive that you can do. We just dive straight into hair transplants. There will be people you can find in your area. I want to talk about eyebrow transplants too, but there's 3 little questions. One is approximately cost. That's what, everyone wants to listen, but a lot of people never want to listen if they feel it's not within their, saving up for possibilities. So what are we looking at cost-wise, Greg?
So for you, with your temples, you'd be looking at something between £5,000 and £7,000. So we charge per group, not per hair, but per group of hairs.
Yeah.
And the more hairs you're going to transplant, the more expensive it will be. Now, a lot of women, I should just mention, there are 2 methods of harvesting the donor hair. We can go into the detail if you want, but one's called a strip technique, where you cut out a strip of scalp skin, stitch it together, leaves a linear scar. And the other is called unit excision, where you drill out the individual groupings of hairs, leaves you with thousands of little round dot scars instead of one linear scar. And 99.9% of the women I operate on will have the strip technique, so a cut. So yeah, it is a bit painful post-procedure.
Like for a week or 2? I mean, you're obviously not going to color your hair for a while, are you?
Usually about 4 to 6 weeks after is fine.
Okay.
So yeah, it's a bit sore afterwards. Most women, I have to say, have higher pain thresholds than men, but sorry, boys.
It's all about the planetary matrix as well. But it is, I mean, that for the majority of people is a huge amount of money. It's like, I'll buy a car or I'll get hair transplant. So
yeah, it is life transforming, and the difference it makes to a woman's self-confidence, their self-esteem, quite often, the impact on their relationships, everything, that they can let the wind blow, pull their hair back, and not be doing what you're doing, which is constantly trying to cover up something that they're ashamed of. Okay,
so that's how it works. What I do want to go on, because lots of people are like, I need to have a cheaper option. So we will go on to those in-between things that you think could help. But just to finish off, Greg, how long until women begin to feel they will see something, and what do they see, and what's like when you've had it done? I know you sent a picture where there was a slight scab. How long does that last? Can you cover it? Or just give me that 6 months post, what happens?
Yeah, so on the day of surgery, generally I will shave the triangle. If we're talking about the temples, shave that triangle right down to skin. The transplanted hairs fall out after about 2 weeks. Your own hair grows back, but the transplanted hair.
Oh, you mean you shave your hair you've got there as well?
Yeah.
Why?
But because it gets in the way of the transplant. So you have to, when you're making those little holes, you have a lot of hair in that area. It's just very fine and downy. So we remove it. It's like on a blank canvas.
Remove that totally.
Yeah, a little triangle, but you'll be able to cover that with your hair. And as I say, your own hair grows back. Healthy hair grows about 1 centimeter a month, but that miniaturized hair will grow slower.
Yeah.
And then the transplanted hair starts to appear at about 3 to 4 months. Again, as a fine downy hair, which then thickens up over about 4 months. So at about 6 to 8 months, you're starting to notice something. It takes about 18 months for the diameter, the shaft of the hair to fully mature. And then, as I say, the hair grows 1 centimeter a month. So your hair might take, 2-3 years to fully grow that length. But a big difference will be noticed at 6 to 8 months.
Okay.
And, you're talking about cheaper options. And a lot of people will spend a lot of money on things like PRP. And I don't know, have you ever heard about fat injections?
Well, I'm going to talk about that because I've had done, and I just want to go through that with you, Greg, what I've had done already. And I'm waiting to see the result. But quick question.
When did you have it?
I had it done in November, but I'm gonna talk about that in a second. But I want to quickly ask you, somebody's asking, will transplanted hair fall out again in the future if you are menopausal? So if you have transplant done before you're menopausal and then you're menopausal, will that fall out?
So no, I mean, people who are menopausal, you know, they don't go bald. Their hair quite often deteriorates. So when we're talking about hair density, we need to think about three things: the number of groupings per centimeter squared, the average number of hairs per grouping, and the diameter of the hair. And those three things will impact on the thickness of your hair. I mean, other things that impact also on appearance are color and curl and hair to skin color contrast. But the three main determinants of thickness, of the appearance of density, as I say, are the number of groupings, the average number of hairs per grouping, and the diameter of each hair. So it could be that, you know.
No, but so it's going to vary then, is what you're saying, per.
Yeah, the bottom line, the answer to that question is no, the transplanted hair is taken from the strongest area and it should remain strong. Longer than the surrounding hair. But again, you know, what we don't understand is why do some women develop just those temples at a certain point in life, or brought on maybe by a stressor? Why do some women lose hair all over? Why do some women develop a male pattern of hair loss? We just sadly just know these things.
Okay, I'm just going to answer a few questions now. I do. Lots of people love my hair, Greg, and I love my hair. Don't for a second, ladies, think that I don't appreciate and love my hair. I think I just want to illustrate by doing that women can go, yes, that's me, and it really bugs me. So it half bugs me. And some days I don't care, but I do this, but I have enough hair. So I'm like, I'm not near a transplant yet. Okay. But I did try in November stem cell. And they took a tiny bit. I did it with Dr. Seabag, and I've done a film on it, which I'll show when if I see change. But they took a few of my fat cells. They got the stem cells from it. So in the end, there was like 2, literally hardly any, and injected them, you know, around my hairline to see if that will help of putting that back in. So I have got this little hair here, which I never know, is that the new hair growing or is that broken hair? I'm at that stage of not knowing. So that is one thing I have tried, Greg. Now, have you had that, do you know about this stem cell treatment? What are your thoughts?
Yeah, so this is innovative stuff. It's cutting edge. There's a lot of debate about it internationally.
Yeah.
Again, it falls into the remit. Really don't understand what influences hair loss and hair growth and ultimately hair health. There's similarly with I don't know if we're going to talk about PRP separately, if you want to include it.
No, I think we can talk about PRP now, because it is about, people are talking the most basic thing of oxygenation of the hair follicle and brushing your hair. My mother brushed her hair vigorously, always believed that oxygenating her hair gave her healthy hair. That's an old wives' tale. I don't know, Greg. But PRP is that stimulation, and it's, so talk about PRP and hair. PRP and hair loss.
Well, let's go back to your mother. Oxygenation and scalp massage and increasing blood flow. I've got a colleague, Dr. Sophie Schotter. I don't know if you know her. She injects Botox for women, perimenopausal women who've got really sweaty scalps. Yeah. And that works for that. But she says she thinks, the women think their hair gets better with Botox, and Botoxing your scalp for hair growth is a thing. Again, not evidence-based. None of these things have reproducible, good quality, research-based evidence. That's my starting point. Okay. And all of them have one thing in common, which is the microneedling element. And you can microneedle your scalp just on its own, not do anything else. You can microneedle, or you can microneedle and rub on things, or you can microneedle and inject things. That's mesotherapy. Or you can microneedle and inject PRP, which is platelet-rich plasma. So platelets are packed with growth factors, and they're a component of your blood. So you take some blood, you concentrate the platelets, you re-inject them. And in theory, what you're doing there is injecting growth factors. I mean, I have
heard that working very well with 2 women who were quite anorexic and had hair loss from anorexia. and they had that PRP with some vitamins as well in it, but just that combination of the, attacking the scalp with the needles and putting something in there to kind of water the garden.
And without focusing on individuals, was that in combination with improved nutrition, or was it that they had recovered but their hair hadn't recovered? Because as I say, anything you do to your hair, you have to remember, I mean, people do stuff to their hair and then like a month later say, oh my God, my hair is so much better, it's worked. Your hair is all dead. So nothing you do is going to improve the strands of hair you have. It has to grow up.
Can we talk about that? Our hair is dead, because that's such a big thing. It's like all these shampoos, they're dealing with dead hair. They're coating to give you that feeling of something lovely. But microneedling, it's not dealing with the dead hair. It's dealing with the scalp and the follicle. How deep would the microneedling be? Would you do a 1 millimeter needle?
Yeah, again, we don't know. So, the home use devices are supposed to be less than 0.5 millimeter. How deep you go, we don't know. The hair follicle itself, the base of the hair, people may not know, the base of the hair is actually beneath the skin and the fat. So if you're going to get right down to the base of the hair, you're going down 5 millimeters into the skin. Actually, a lot of
if you have it done professionally, how deep do they go, do you think?
1.5 millimeters, maybe.
Okay.
But then becomes painful. So if you're having microneedling for scarring, for instance, sometimes you have to be put to sleep to have that done because it's so painful.
Yeah.
So, we just read, I keep saying this, there's so much we don't know. But my point was going to be that when you're microneedling the growing hair, it then has to, if you think that's going to improve the diameter of the hair, it then has to grow out long enough for you to notice that in your hair. And at a centimeter a month, that's 3 months before it's just 3 centimeters, 6 months before it's 6 centimeters. So it's a long time. And then during that time, trying other things at the same time. Are you improving your diet, changing your diet? You're less stressed. Are you recovering from a stressful period? Studying hair is really, really difficult.
And very difficult to see cause and solution working. Is I think what you're saying, Greg.
And also, I mean, for those people who are going to be paying for things like adipose-derived stem cells, fat-derived stem cells, and PRP, you're going to spend a lot of money, invest a lot of hope for probably pretty subtle improvements. So there's that balance. Do you save up for the big bang, something that's really going to make a difference? Or do you throw money at these things that potentially going to have to be repeated every 3 or 6 months or every year, with you hoping that it's going to do something? I'm interested to see whether or not your intervention worked.
Like, I'm just going to address in the room, there's a little cynicism here, because they're saying, of course, you're going to promote your own product. All right. Now, just if you've joined recently, ladies, I want to cover the whole remit of hair loss. So I've got on Dr. Williams first, because he is the extreme end of hair loss solution, which is a hair transplant. And he is one of the best in his field. He is talking generically about hair loss and treatments, and also things like PRP. At the other end, we have got Change Your Hairstyle, which I'm going to do next week with Josh Wood. Shabir talking about supplements that he thinks helps in his opinion. Now, what I really appreciate you're saying, Greg, is we don't always know what's helping. It's like when we try a ton of skincare creams, ladies, it's like, is that the retinol that really worked? Or was it the microneedling you did properly 5 days in a row? And did the LED mask work? Unless we was to singularly try things for 5 months. And with hair, Greg, you're saying, it's an even longer period. With, retinols, I try one for a month and I'll go on to another one. And that's how I can see, is that the retinol that was really good? I think the same thing applies, that it's about a patient's game more than any other beauty routine. Because if you really want to test what's working, you could, for a month, try a Regain for Women shampoo. You could then, see if that's going to do anything. I know you're going like this. I know, but I'm just saying.
No. What I'm saying is you have to do that for a minimum of 6 months. Not
okay, 6 months. Then sorry, 6 months. Yeah. Okay. So there is a far longer journey to look at the solution. That's That's what I'm going to say. And Greg is here, and I'm really happy Greg is here, because I've always wanted to understand what happens in a hair transplant, how much it is. And I also appreciate your saying, Greg, because I know many times I have done, it's like the difference between have a facelift or do tweakments. You know, it's like a plastic surgeon will say, just have the facelift. You know, don't do all these little things, because they'll all add up to the cost of a facelift. And then you're having the facelift, which is all a go in one. For me personally, I'd rather never have the facelift, Greg, and I'd rather do tweakments. I'd rather, you know, do my Botox and do a thread and do some PRP and just do that maintenance of my skin. So with hair, I think it's really important that it's your personal choice. And I think for women, they've got to think, how much of an issue is this for you? How much, when you wake up, does it affect your day? How much are you focusing on it? You know, so are you in a position where you could say, I'm so distressed by this that I want to go for the long-term solution, and then I'll need to save every month and decide I don't spend money on clothes or beauty products or whatever it will mean, you compromise to save up that money to do it. So I'm going to say that's one end of it, Greg. And I just want to be really, you know, balanced here. The other one is that there's other things that we can consider. So PRP, we've talked about a bit with Greg. Can we just also, people talk about these ultraviolet lights and all these other things. And I know your specialty is hair transplants, and I know you've had a lot of women who've nothing else has worked. So you're seeing women who've tried everything and then ended up coming to you, Greg. But do you believe that there are some things that can work for women with short-term hair loss where they don't need to go to the extent of a hair transplant?
So categorically, yes. So don't get me wrong. I do believe PRP works. I do believe that microneedling works. I do believe that mesotherapy. I believe that all these work in some people, but I suspect that in the majority they don't. And we don't know who it will work for and who it won't work for. And a lot of this is how it's sold to you. So if it's sold to you that, you know, have a go, and if it, you know, spend your money, if it works, fine. If it doesn't, fine. And by the way, you're going to have to repeat this every 3 to 6 months. And this is going to be the cost of doing that, because no point it getting better for a little while and then getting worse. So I do believe all these things work. Low-level light therapy for hair. Yes, I speak to all my patients about it. There are a number of devices. There are combs and caps and bands, all with a wavelength around 650 nanometers, all based off of the research that was done ages ago on one device that actually uses the wrong wavelength. So we know in Petri dishes and labs, certain wavelengths of light stimulate hair. Yeah. What we don't know is what's the right wavelength in hair. It has to get through the scalp, down to the cells. The more hair you have, the less it's going to get down. We're talking about red light. Blue light, which is good for skin in theory, does not penetrate deep enough for hair. So we're talking red light. Yeah. Trinny, there's one big that we've missed out, which you kind of just touched on, and that is medical treatment for hair loss. Proven medical treatments. And what we have that every woman should try, I would suggest, Trinny, and I don't know if you have, Regain for Women.
Tell me about Regain for Women. So do you believe in that this can help some women, Regain for Women?
Categorically.
Okay.
So it was up to, I don't know, what, 6 or 7 years ago, it was licensed as 2% liquid used twice a day in women. It's now licensed as a 5% foam used once a day. And one of the side effects, it's over the counter, so and you know, relatively inexpensive. Again, you've got to use it for long periods of time before you can judge a benefit. And a benefit may just be that it doesn't deteriorate. One of the side effects is increased facial hair, which is counterproductive. But what I will say is that
so can I just say, you put the Regain on your hair,
and you rub it into the scalp.
But you can get increased facial hair.
Yeah. And it used to be, I think, because that's what it's doing.
It on here, why is it you get increased facial hair here?
Well, potentially because it is moving at a microscopic level, is moving down, or it may be that it's being absorbed and having a systemic effect. And that's what I want to come to, is that originally Regain, the drug name is minoxidil. Minoxidil is a pill for high blood pressure. So 2 decades or 3 decades ago, people were taking it for their blood pressure and their hair was getting better. and the topical preparation was developed. There's a full circle now, and there's a huge amount of interest in oral minoxidil as a pill. So the high blood pressure dose is 2.5 milligrams. The hair dose starts at 0.625 milligrams, so a quarter of the lowest hair blood pressure dose. And there's huge amount of excitement in our field about this for women. The research is coming out. So the only medical licensed treatment for female hair loss, sadly, is topical minoxidil, Regain for women. But there are a number of off-licensed medications that dermatologists will use, such as oral minoxidil, but also oral finasteride, the big drug for men, for male hair loss. It's not licensed to women because of the potential for birth defects, but in postmenopausal women, it can be used if the hair loss cause is thought to be too much male hormones, because this is a male hormone blocker. And then also spironolactone, which is a diuretic, a water tablet, also has some anti male hormone properties, and that's used as well. So there are non-surgical medical options. Rarely you want to be seeing a dermatologist for. You know, these days you can get anything off the internet. Really, you want this managed by somebody who can track the effect over a period of time, potentially with objective photography or other measurement or objective.
So, and there are many out there, and I think that finding a good hair is, I mean, I'd call them a trichologist, but would you call them, you'd call them a hair dermatologist?
Yeah, so trichologists are non-doctors who specialize in scalp and hair loss. There is the British Hair and Nail Society. These are dermatologists who specialize in hair and nails. That's a good starting point.
Okay,
British
and the name of the
Nail
product for men is Regain for men,
no,
isn't it? No.
Well, yeah, so there's Regain for men and Regain for women. It's actually the same product.
Fine, okay. The other thing people are asking about is Foltene. Do you know what Foltene is?
No, what's that?
Foltene. I don't know.
Foltene. Let me look that up.
Yeah.
Ask me another question. Foltene.
Foltene. Now, somebody might have misspelt it.
That seems to be a shampoo.
Yeah.
It's a shampoo. So I will say, and this is a fascinating subject. If you really want somebody fascinating, get on, oh gosh, what's his name? His name escapes me. Who he's an expert on a scientist on hair, and he talks about the role of water in hair, because a lot of women think that if you hydrate the hair, it's softer and glossier. That's actually not true. And so much.
Sorry, I'm going to counteract you, Greg, because if I wash my hair, I mean, we have hard water in London. So I think if I have a place in the mountains in France, I wash my hair, it's like a baby's bottom because the water is so soft, it comes straight off the mountain. I wash my hair in London, and if I do that really cold at the end, my hair is shinier. I know it is. So I'm not just feeling it. The guy who blow dries my hair will say, you know, when I'm at the salon, I say, end with the cold rinse, and it's shinier. I just feel that. You think that's all crap?
To do with a reduction in friction. So this is looking at it from a scientific point of view, from studies. I'll get this name to you.
That's fine. No, that's fine.
You know, shampoos and conditioners. Gosh, there's so much marketing into what goes into that.
But you talk about Regain, which is an over-the-counter shampoo. Well, it's a post-shampoo treatment, isn't it? It's a post-shampoo treatment. Yeah.
It's a drug.
Okay. So you're not that keen on, I bought from Sainsbury's last week, a German brand, very famous, beginning with a P, which is for women in their 40s with hair loss.
Yeah, it's got a green bottle.
What?
A green bottle.
Yeah, it's called Planter or Flanter or something.
Yeah, so it's the same company that produced Alpecin, which is the male equivalent, got caffeine in it, yeah?
Yeah, got caffeine in it, exactly.
They were taken down by the Advertising Standards Authority, Alpecin was, for false advertising. And it's on my list of things to report them to the Advertising Standards Authority because it's false advertising.
Well, that's good to know because it was on the down to 50% off in the Sainsbury's bottom shelf. So it could be they've already been taken down for advertising. And I do think, Greg, I do agree with you that there is a lot of planter. Thank you very much, Karina. That there is a lot of, buying into women's emotions and providing products. And I also, just on a personal level, Greg, I feel that if I do a shampoo and then I do a conditioner, there's no opportunity there for it to make a change to my hair, because it's on and off with the water. So how can it in 2 or 3 minutes make an impact on hair growth? So I do find that, yeah.
So there's an integral component of water to hair, and then there's hair that comes and goes. Water that comes and goes. And that element that you're feeling is making your hair better is what you're washing in when you put water on it. But in terms of actually hydrating the core of the hair, more water in the hair does not improve the hair quality. It's actually the opposite.
Yeah.
So it's Trefor Evans, Trefor.
Yeah.
Evans.
Okay.
He's at Princeton. He is the most fascinating guy. 30 years of research in hair.
All right, maybe we need to get him on next.
Oh my gosh, definitely. Okay. He gives an amazing talk about the mismarketing, the billions that are spent in, because you know what, you're right, and this is really important. Women with hair loss don't talk about it a lot, but are very psychologically affected. Mm-hmm. And so they're vulnerable. And so they spend loads on their products, just like on their skin, loads on their hair products, loads on hair tweakments that sound great, and lots of flashy advertising and potentially before and after pictures make a big difference.
Okay, I'm going to just reiterate here. I'm with Dr. Greg Williams, who is a hair transplant surgeon, and he's also been talking about Trefor Evans, who is a renowned hair expert. Somebody has actually put here, Maren, Princeton, and his organization. Is he at Princeton?
No, it's called Princeton. I don't think it's associated.
So that's great. I'm finding you very objective, Greg. Some people are very riled up by, lots of things. And I think that's what we love about Wednesday morning skincare Q&A is everyone will have an opinion and everything is out here to be discussed. So I just feel it's been such an interesting conversation with you. I do think that we've looked at this whole medical side. And if you feel that you're wanting to go down that route and everything else in your mind, which you've tried for long enough, has failed, then we have learned today all about hair transplants. They're not as scary as those darling nameless pop stars where you look and you think, oh my God, they've had a hair transplant, which we've seen a few times. So I think I'm going to discuss next week with Shabir his opinion on what we're going to be putting on our hair and the effects of that, and with Josh Wood about how you can style your hair if you feel that you don't want to use products and a hair transplant is not within your remit. I want to say goodbye to you, Greg, and thank you so much for coming on. And it's been incredibly enlightening just to understand the whole premise of what is a hair transplant, how does it work, and what are those other treatments around it that you rate as well. And I'm going to say goodbye to you now and chat 2 more minutes to my ladies. But can we give a round up for Greg?
It's been really fun talking, Trinny. Thank you so much. My take-home message is get a diagnosis from somebody who knows what they're talking about.
Brilliant. And we'll leave your details if you want to be in touch with Greg directly. They'll be on the feed too. Thank you, Greg. Right. So I found it fascinating. And there was such an animated chat. And I think that's great. We always want to have stimulating conversations here. I found Greg very informative, and he taught me a lot about the concept of a hair transplant. Now, for many women, they want to feel, are there other things at work? Is a change in diet going to help? I think this man sounds fascinating, who seems to be a huge hair expert. And has researched hair. What I found also most interesting is there's no clear-cut answers as to why we suffer hair loss. And we can all personally know, maybe I was really stressed the whole year. I've had an illness, I've had cancer, I've gone through a big illness, I've had COVID, I'm going through menopause, all these things, and we will feel our hair is getting thinner. It could be just over the passage of time, our hair is getting thinner. It could be that we use straighteners every day of our life and our hair is breaking and it all round feels thinner. It could be that you've been dyeing your hair, bleaching your hair for 20 years, and your hair's just finally saying, I can't take it anymore. And then are things like Olaplex really going to help, or are they a marketing treatment? Now, they are available at salons. So we'll discuss all of that next week. And I think Josh Wood will be great about his perspective as a hairdresser, and Shabir from Victoria Health should be really helpful on just supplements he believes in. And if I can have a chance to bring in Trevor Evans, I'll bring him in too. And thank you so much for listening. Amanda, thank you very much for hosting on our background. And I know that there's been many, many comments. So I'm glad you've all been interested to hear about it. And I, for myself, am not going to have a hair transplant. I don't feel I'm at that place, and I don't feel I need to have one. I do feel that I'm going to try little things, and I'm microneedling. I have tried this stem cell treatment with Dr. Seabag, and it's only 3 months in. So I'm not going to show you that whole result until 6 months in. Patience. This is the big thing about hair, is having the patience to see the changes, whatever treatment route you decide to go down. Joyful to hang out with you, ladies, and we'll catch each other soon. And just for Monday, happy International Women's Day. I didn't say it on this channel properly. I think I did when we did the launch of Sharon, but I just want to say that to you. And yeah, great. I'm going off now. Have a great day. Bye.